Welcome to Health Reform Watch. I'm your host, David Morgan, healthcare policy correspondent with Reuters. And today we have with us Professor John McDonough of the Harvard School of Public Health. Professor McDonough is also director of the Center for Public Health Leadership. How are you today, John?
Great, thank you. Nice to be here with you.
And it's nice to have you. There's been a lot of news about the Affordable Care Act within the past week. We've learned that the number of people signing up for plans is actually much higher than anyone supposed that it would be even before the rollout in October.
And as more data comes in, we now know that the number of Americans who've signed up for private insurance in the marketplaces has grown to 8 million.
We have also had the resignation of Kathleen Sebelius and the nomination of OMB Director Sylvia Matthews-Burwell to replace her. And we had a CBO report, a Congressional Budget Office report, which suggests that lower than expected health insurance premiums will reduce the cost of the program over the next 10 years and reduce the cost of the deficit as well. What do all these things mean when you put them together?
Well, I think when you put these different stories together, what becomes clear is that the predictions of a catastrophic failure or a collapse of the law is simply not going to happen. It's not going in that direction. Millions of Americans, we don't know the exact number, who were uninsured are now getting health insurance coverage. We're seeing that the costs of coverage are coming in lower than projections, and in fact lower than CBO even estimated just 2 months ago. So we're seeing a number of good developments, and that indicates why the administration and Secretary Sebelius decided to time the resignation for this period, because we're in a period where the open enrollment is over. There's about 6 months till it starts again, and it is a good time to take a pause and put in a fresh face in terms of the implementation of the law. So I think all of these are signs that the ACA is pretty much here to stay. We will have periods of bad news in the future, but the overall story right now is that the law is working and is a success. And that's why we see this string of stories and this change at the top.
The President's choice of Sylvia Burwell to replace Secretary Sebelius puts at HHS a member of the top echelon of the West Wing. And there are expectations among some Democrats that this may allow the administration to make a fresh start for the Affordable Care Act. Does it seem likely to you that there really can be a fresh start at this point for a law that is so embattled?
I'm not sure that the naming of Ms. Burwell to the secretary position is that dramatic a change unto itself. Although, unfortunately, Secretary Sebelius's image has been tarnished for a long time because of the website failure in the fall. I think somewhat unfairly, but that's the reality. I think the arc really started to change on January 1, 2014, when so many of the concrete benefits of the law were no longer hypothetical and they became real. As of January 1st, Americans can no longer be held hostage by insurance companies for pre-existing conditions. Subsidies to help people buy health insurance, Medicaid coverage for poor Americans to allow them to get coverage, many for the first time in their lives. These are no longer promises in the future, they became real. So it's not a sudden move, the appointment of a new secretary, but it's a progression in terms of the expectations and the promises of the law actually coming to fruition. And that's what's most important, and that's what over time will create the shift in the public perception around the law.
So what do you see as the advantages that Sylvia Burwell is going to bring to HHS if she's confirmed by the Senate? I mean, she has an intimate knowledge of the budget numbers, and she has a reputation for being an extremely good manager. But HHS is a far-flung, sprawling department, and one has to wonder, I suppose, whether she can actually run the department adequately while providing the kind of focus on the Affordable Care Act that perhaps some people in the administration would like to see?
I think Secretary Sebelius was an excellent choice for the period in which she served as secretary. As a former governor, as a former state insurance commissioner, she had an intimate understanding of so many of the critical policy decisions and choices that needed to be made between 2010 and 2014. I think what's really necessary now, and why the appointment of Ms. Burwell is so promising, is because she brings a deep management talent and implementation skill to the table that I think is really necessary. In some ways, it resembles the change in the chief of staff in the White House from the more politically oriented Rahm Emanuel to the more detail-oriented management guy, Dennis McDonough, to a similar kind of change from Secretary Sebelius to Ms. Burwell, who I think also brings some of the main talents that we see from the current chief of staff as well.
What do you think public perception of the law will be over time?
I think we will see steady improvement with some ups and downs going into the future, because the catastrophic predictions of failure have not happened. And so we are seeing people get coverage. We're seeing the numbers, and we're seeing so many individual stories now of people who are getting helped. And we're seeing many Democrats coming out of their shell. There's Senator Begich from Alaska running for re-election, has an ad that has just gone up that talks about a woman, a cancer survivor, who could not get health insurance in Alaska because of her pre-existing medical condition, who now has it because of the ACA. So increasingly we are seeing Democratic office holders come out and embrace the benefits of the law and take credit for the good things that are happening to people. So it will take time, and Republicans who oppose the law will continue to play to the political base of the party that is still deeply alienated from the health reform law. And I believe we're seeing a significant shift right now going on.
Significant shift of what kind?
In terms of opposition to the law diminishing, in terms of fewer people saying that the law is going to harm them in a significant way, in terms of more people acknowledging the benefits of the law and the good things that it's making happening around the country right now for millions of Americans.
So do you think that this makes it harder for Republicans to turn the November election into a referendum on Obamacare, which is what some Republicans have said their aim is?
Republicans have had to do a switch. Only very few of them run on the platform of we're going to repeal Obamacare in toto. And they now have to switch, because they are now no longer threatening hypothetical coverage. They are threatening real health coverage that millions of Americans are now enjoying. So for most of them, their stance has to change from I'm going to repeal the law outright to I'm going to get rid of the parts of the law that are least popular. So we'll see more and more people say, more and more Republican candidates say, I'm going to repeal the individual mandate. I'm going to repeal the employer responsibility requirements of the law. I think we'll see a lot more of a nuanced response while they're still articulating a broad condemnation of the law.
Thank you very much, Professor. We're about out of time. And until next time, this is Health Reform Watch.